I'm Dr. Ratima Chopra. I'm a certified maxillofacial surgeon.
Which teeth are called wisdom teeth? What is an impacted tooth?
Wisdom teeth are also known as third molars. They usually erupt in your late teens and early 20s. 70% of the Indians have once in their lifetime experienced pain in their third molars or wisdom teeth due to lack of enough space in your jaws or any kind of obstruction. This obstruction could be a tooth, gums, or even bone. Such teeth are known to be impacted teeth.
When should one remove their wisdom tooth?
Impacted teeth, if neglected, can cause serious problems. There are few signs you need to take care if the impacted tooth is present. First is pain. Pain in and around that area that usually radiates to the ear and the head. Any inflammation or infection in the gums in your third molars. Cyst associated with the third molar that is usually causing a facial swelling very frequently. Halitosis or frequent bad breath. Decay in the tooth adjacent to it. These are the signs that when it happens, you need to make a visit to the dentist.
Is wisdom tooth extraction a surgical procedure? Which type of radiographs are required?
Whether these wisdom teeth have to be removed surgically or non-surgically is purely the call of your maxillofacial surgeon, and that is done with the help of X-rays. OPG is the first radiological investigation that is done. It is a 2D representation that shows the relationship of the wisdom tooth with the surrounding bone. Whereas the CBCT shows the relationship of the wisdom tooth with the surrounding bone as well as the vital structures around it. For the lower wisdom tooth, it is the relationship with the inferior alveolar nerve, and for the upper wisdom tooth, it is usually with the maxillary sinus.
What kind of anesthesia is required for wisdom tooth removal?
Local anesthesia is when a specific area of the jaw is anesthetized. The recovery period is faster, the patient is conscious, and the cost is also lower. In general anesthesia, patient has to be relatively fit and healthy, and patient is unconscious during the procedure. The recovery also will be a little slower and the cost will be high.
How should a patient be prepared before coming for wisdom tooth removal?
To make sure that somebody more than 18 years of age is accompanying you on the day of surgery. Make sure you have ice pack in your refrigerator once you come back for the ice pack application. No smoking or drinking before the procedure. If it is happening under general anesthesia, you will be required to avoid eating or drinking anything after midnight one day before the surgery.
Can you briefly explain the procedure of wisdom tooth removal?
Most of the people think that third molar surgery is a painful procedure, but that is not true. With the right kind of anesthesia and the patient comfort, this can be a completely painless procedure. Most of the wisdom teeth are impacted. Therefore, an incision has to be made in the gums. Some amount of bone around that area has to be removed. The tooth is usually sectioned or divided and then removed. The gums will be sutured back onto their original position.
What are the post-operative instructions to be followed after wisdom tooth removal?
These are the things you need to do for a better healing and faster recovery. Once the procedure is over, your surgeon is going to ask you to bite on a piece of gauze for 45 minutes to 1 hour. Do not replace the gauze after 1 hour, as continuous replacement can cause disruption of the clot. The first 24 hours are extremely important in the healing period. Avoid vigorous rinsing or spitting. Consume food that is soft and cold, nothing hot or spicy. Make sure that you have juices, but don't use a straw during this period. After 1 hour, consume something like curd or yogurt, and immediately after that, start the medications that have been prescribed to you. Ice pack application has to be done. Between every application, a 10-minute interval should be there. Avoid smoking and consuming any kind of tobacco. Make sure that you're not doing any strenuous activity in the first 3 to 4 days. Swelling will start coming down after the 3rd day, and that is when you make the visit to a dentist for a review. After the first 24 hours, warm salt water rinses, brushing, and oral hygiene practices should be presumed. Avoid sleeping on the side of the surgery and start your mouth opening exercise after 24 to 48 hours.
What is the cost of wisdom tooth removal in FMS Dental Hospital?
In FMS dental hospitals, third molar surgeries under local anesthesia may vary from 8,000 to 20,000 depending on case to case. In general anesthesia, however, it varies because every case is different. We have an excellent team of maxillofacial surgeons who perform these procedures with utmost care and the most comfortable way possible. And therefore, wisdom tooth surgery is a fairly safe and common procedure when performed by a maxillofacial surgeon.